Right, so a couple of tips. When you're laughing or you want to be loud, just lean the fuck back. Exactly.
Excellent.
And it'll sound loud in your ears. That's why
Yeah.
you have the, oh my God, you can hear the planes. Can you hear that?
I was going to say, is that the planes or is that my blood flow? Seriously, I can't tell.
It's the planes, babe. So I live near the airport, guys.
I just heard a rumble, but it's
It's that mic.
Drink.
I'm going to get another one of these mics, the Rode mic.
Another of those.
I'm going to get another one for you.
Oh.
But in the meantime, I just wanted to get started. So
Yeah.
you're on my singing mic.
Yeah, no, that's okay.
So live your best pop star life.
Has this actually got stimulant in it?
I don't know.
It smells like hand cream.
Olivia's currently having a vitality shot. What's it called? Magic Mind. Fuck off, fly. God, I wish it would die.
We can't record until it's dead.
I know. This fly is killing me.
All right, Mr. Fly.
Can you just take him out? He's in the window. Just unload half a can on him and let's just get this pot on the road.
I'm not happy because I'm a perfectionist.
That's all right.
You know this.
I do.
You know this.
In certain things.
Yeah, no, in certain things. Other things, I don't give a shit.
Yeah, same.
See you later.
We're very Siebes energy. That's why we're friends. All right. So hello, everyone. Welcome to the pod.
Hello. Thank
It's
you.
our very first episode
We're playing
ever.
footsie already.
I know. Welcome to Nurse Ratchet.
Oh, yes.
I'm so excited to be here. Are you excited, Olivia?
Absolutely, yes.
My name is Georgia.
And I'm Olivia.
And we are here to bring you spooky, scary, true crime stories. Mm-hmm. Is that the feel of our podcast, do you think?
So.
Yeah. We're making it up as we go along, isn't it?
Yeah.
Yeah,
Whatever
100%.
feels right.
We've and ahed about this podcast for a long time, haven't
God,
we?
yeah.
For like a good 12 months, even
I think since
longer than that.
No, since longer. Since we became friends.
Since we were bought.
Yeah, like at least 4 years ago, you started talking about this.
100%. So we're very new to podcast world, ladies and gentlemen. Thank you for joining us and bear with us while we smooth out the creases.
Yes,
We're working it out. If there's any issues with the sound, do let us know. I'm pretty sure that you can comment on podcasts. Not sure.
I don't know.
We'll work it out.
I don't know.
Our aim is to, do a few episodes and then release it. So, all right. So Olivia and I, we met at work.
Yes.
Olivia is currently my work wife and will forever be my work wife.
Yeah, always have been, always will be.
There's no divorcing.
No.
We don't believe in
Not
divorce
legally, at least.
in work wife world, do we? So we met in the pandemic, didn't we?
Yeah. We were, what's the word? Bubble buddies.
We were. I was your bubble buddy, yes,
Yeah.
and we kept each other going, didn't we?
Oh, absolutely.
We bonded over a mutual hate of our co-workers, didn't we? Yeah.
Those nights with Punston were rejuvenating.
Punston is my cat, aka Preston is his birth name. Olivia turned up at my house and she said, "What's your cat's name?" I said, "Preston." She's like, "Hi, Punston." And it's just
It stayed that way.
as Punston ever since. I was doing agency before the pandemic, and then I had to get a permanent gig, and I turned up at her work, and I was like, "Hey, bitches." And the rest is history, isn't it?
Okay.
Tell us about yourself, Olivia.
Well, I've been a registered nurse for 7 years now.
Slang.
And thanks. And I've worked in all kinds of areas. I've worked public, private hospitals, and I've done all kinds of specialties: cardiac, neuro, cath lab, general, gynae, obstetrics.
In the operating room.
Oh, yeah. And in recovery
So
as well.
perioperative.
All kinds of stuff.
Yeah, perioperative.
Yeah,
right?
that's
Yeah.
right. Yeah. And, I've just done a bit of everything, I guess. And now I've sort of settled doing more day procedure stuff.
Mm-hmm.
So it's a
And
nice
how are you
change.
finding it?
It's a nice change.
Yeah, it's more chill, isn't
Far
it?
less stressful.
Yeah, because
Don't
you
have to
trained
pay
in a
for
trauma
boring.
centre, didn't you?
Yeah, exactly.
Which is pretty hectic.
Yeah.
So you're well versed in the cardiac arrest.
Yeah, yes. Far less patients die in my current job than they in my previous one.
Which is always ideal.
Yes, far better to go home at the end of the day.
Nice. I had the opposite training. I did train in a public hospital too, because that's kind of what we do in Australia for the people who are coming overseas. You get a grad year. If you're doing RN, you get a grad year, which is a year of working, and then you usually do that in the public system, but you can do it in the private system as well. But it's more ideal to do it in the public sector, because you get a lot more experience with unwell people. Yeah. Yep. So I trained in a big public hospital as well, and we didn't take traumas, and we didn't take kids, and we didn't do maternity, but we did a lot of homeless, drug addicted people. So that was interesting in itself. Lots of mental health patients, suicide attempts, all that jazz. So that was pretty hectic in itself. And we also were one of the hospitals that do organ retrival for people that died.
I've done some transplants.
Transplants,
Harvests and stuff.
Harvests, like that, which is a horrible way of saying it, isn't it?
And most
harvesting
of them are young
someone's
as well.
organs. Yeah, and they almost always are, because they have to be like healthy organs and shit. Anyway, we're rambling.
Moving on. Holy moly.
Our aim is to keep things light, but you know,
we are Nurse Ratchet. So.
We are, and we are going to touch on the dark things, but hopefully keep it light all the way through. But we'll see. So what we're doing today, Olivia, have you heard of RaDonda Vaught?
Oh yeah, a couple of times in the news here and there.
Yeah, she's been all over the news. Did you know that med errors are the third leading cause of deaths in America? Isn't that insane?
Med errors? Right.
Medication
Drug
errors is the third leading cause of death in America.
Oh, I see.
Let that sink
in total.
Yeah.
In all, right. Holy
shitballs. I don't actually know what the comparison is in Australia, but I'm pretty sure it's not med errors. I'm just going to put it out there and say it's not med errors.
I'm pretty sure
we
it's...
could ask Siri.
We've got cardiac disease, stroke, diabetes.
That's
the most...
from what I've seen.
Yeah. Oh, and then dementia's like top 5 as well, top 5 killers.
So that would sort of give you an indication that shit's going a bit awry in the States. Like, what the fuck is going on with your hospital system?
Well, they don't. They barely even have one.
Yeah, I mean, true. So the story that we're going to discuss today is a malpractice case involving an ICU nurse called RaDonda Vaught and a 75-year-old patient called Charlene Murphy. This incident occurred at the Vanderbilt University Hospital of Nashville, Tennessee, and it's a mass...
No way.
Yeah.
I'm pretty sure
Do you know that hospital?
Max's mum works.
Shut the fuck up.
She's a nurse.
Hectic.
It would be interesting to
Close
see
to
her
home.
Thoughts and perspective on
You should ask her.
the healthcare system there.
Oh, interesting. RaDonda Vaught's criminally charged for a mistake. Good. As we see. Is it good?
Yet. Let's find out, shall we?
Exactly, yeah. She is undoubtedly at fault for the blatant and numerous errors that she made, but it wasn't the only thing at play here. As we'll see, Vanderbilt Hospital completely denied any kind of accountability, avoided any kind of disciplinary action.
Really?
Yeah, for the policies and procedures that were in place that ultimately contributed to the mistakes for RaDonda Vaught and the death of Charlene Murphy. So this is a juicy case.
This is a classic Swiss cheese.
Oh, it is though. It's a classic Swiss. RaDonda Vaught was born on the 25th of the 1st, 1984, making her 42 years of age at the minute. She's married to Ed Vaught and currently residing in their homestead known as Hidden Hollow Farms in Nashville, Tennessee, where they raise sheep and chickens and sell the eggs at markets. Doesn't that sound picturesque?
Yeah.
In 2012, she attended Western Kentucky University of Nashville to achieve her BSN, which is Bachelor of Science Nursing, if anyone was wondering. She was named to the Dean's List. Excuse me, guys, the plane's going over, one sec. She was named to the Dean's List, which actually means like that's the highest level of academic achievement you can get in university.
Yeah.
So she's a smart cookie.
Like your name gets recognised.
Who?
If you get on the Dean's List.
Yeah, sure. She graduated in 2015, and this incident happened in 2017. So she was a newish nurse, yeah.
Right,
but
so she's only graduated a couple of years before us.
Yeah.
Wow, I didn't realise
How is that fly still alive? It just flew right past us.
It's like cockroaches, isn't it? They can survive nuclear radiation.
Anyway, so she was a relatively new nurse, and she got her first job at a local hospital outside of Nashville, Tennessee, in the med-surg unit. And she stayed there for 9 months before applying to Vanderbilt University, which is kind of where everyone goes. It's a well-known hospital.
I've definitely heard the name.
Yeah.
Yeah.
She got the job in a neuro ICU at Vanderbilt University in October 2015.
As a grad?
Yeah, basically. Oh, well, not really, because she did a year after her grad, basically. Yeah.
Wow.
So she went from med-surg to ICU.
That's
neuro
like one of the
ICU.
first mistakes, isn't it? Putting a baby nurse into a neuro
Yeah,
ICU.
I think that's just what you got to do, though. Sometimes there's not enough nurses, isn't there? At the time, Vanderbilt was the largest and one of the most respected hospitals in Nashville. So that's why she wanted to work there. So on December 24th, 2017, a woman named Charlene Murphy, 75 years of age and longtime resident of Nashville's suburb known as Gallatin, was preparing a Christmas Eve meal with her daughter-in-law, Chandra Murphy, and other family members, I believe. Unfortunately, Charlene soon developed neurological symptoms, a headache and loss of vision in her left eye. Her family took her to the Sumner Regional Medical Center, where she received a CT scan and a hematoma on her brain was found. She'd also previously suffered from lung cancer, so she's got some medical conditions underlying. She is 75.
Yeah.
So after her brain bleed was found, she was transported by ambulance to Vanderbilt Uni Medical Center, Neuro ICU, where our lovely RaDonda works. And as we will see, she sadly never left. On 26th of December, Charlene was moved to the step-down unit after improving significantly. So she went there on the 24th, and on the 26th, 2 days later, she was moved to the step-down, so she was improving significantly. Charlene's physicians told her family that she was improving and could go home soon, and the family, as a result, decided to wait to have Christmas dinner until she could come home. Before she could be discharged home, Charlene needed a PET scan, and for the nerds in the chat, that stands for positron emission tomography. It's a scan that shows how the body functions rather than the structure of your body, like an MRI or a CT. During a PET scan, patients are injected with a small amount of short-acting radioactive liquid known as a tracer. The most common one is fluorodeoxyglucose. Say that 3 times fast. It's a simple sugar that has been radio-labelled. That means it gives off energy in the body, which can be seen by the scanner, which is fascinating. The rate at which this sugar is taken up by the body's tissues gives an indication of how active the tissue is. For example, cancer cells grow quickly, so they need a lot of energy and therefore a lot of sugar. This increased uptake of sugar makes them show up as a bright hotspot on the scan. Does that make sense? Healthy tissue also uses more sugar than unhealthy tissue. A scan that shows less tracer than expected may indicate unhealthy tissue or reduced blood flow to the area. So if you have a bleed or whatever, it'll show up if you've got damaged areas in your brain. So I suspect they would have been having a look at her brain to determine if there was a cancer present or just if the bleed had possibly damaged any structures in her brain. You following so far, Queen?
Yeah.
Before the scan, a patient's blood sugar levels are checked and then the radioactive tracer is injected into the vein through the intravenous line. The patient will then rest quietly in a bed or a chair for 90 minutes in order for the sugar to be distributed through the body so that you can get a good scan. The PET scan was located in the emergency room, which was downstairs from the neuro ICU. Charlene was transported on her trolley to the PET scan room. The thing was that Charlene was very claustrophobic, and shortly after arriving, the PET scan technician said Charlene was terrified of going into the scanner, so much so that she closed her eyes when she was talking to her. So, like, severely claustrophobic. So the PET scan technician called Charlene's nurse in the step-down unit. His name was Ethan Gully, and explained Charlene was too anxious to go into the scanner without something to relieve her anxiety. Vibes. Ethan Gully called the doctor on duty to prescribe a sedative, and the doctor prescribed Versed, which is also known as...
Midazolam.
Yes, Queen. Slay. Quiz time. As we know it in Australia, we call it Medaz for short, don't we? Versed is the brand name and Medaz is the generic. We don't know it as Versed in Australia.
Nah, that brand doesn't exist here. Excuse me.
The fly and the plane. 1 second, I'm just going to... Okay. So Ethan Gully called the doctor on duty to prescribe a sedative, and the doctor prescribed midazolam or Versed. Versed is the brand name, Medaz is generic. The doctor ordered 1 to 2 milligrams of Medaz, starting with 1 milligram, then up to 2 as needed. It's worth noting that the doctor specifically said that Charlene had midazolam before, and that she would be fine without monitoring.
Oh, of course she would.
1 to 2 milligrams is like, if she's had it before,
Look,
and he knows that she's fine with it.
I have definitely had half a milligram of midazolam
How'd you take it, babe?
completely cause a respiratory arrest.
Oh,
before.
fuck, really? Oh, with a
Yes.
patient? Oh,
Yeah.
definitely.
And I've had
yeah.
like 2, I've had 1-2 milligrams, rest rate of 2. How
Yeah,
exciting.
wow, yeah.
And what, she's 75? 5.
With lots of comorbidities.
And it also depends on like what
And a
medication
neurological
she's on.
condition as well.
Yeah.
Like,
So how she had
1 to 2 milligrams
And
is
how
her
much
prescription.
Okay.
Or her order.
She never actually got 1 to 2 milligrams because she was given
No, she got something else.
different drug.
Yeah, as we'll see. Anyway.
Yep, nice.
So midazolam is a benzo or a benzodiazepine for anyone who is not medically trained. It's used for sedation and anxiolytic purposes, which is like an anti-anxiety medication. It comes in oral, IV, which is intravenous, or IM, which is intramuscular injection forms. And it requires monitoring, usually, due to the respiratory depressive effects, as we've just discussed. So Nurse Gully was covering for another nurse at this time when he received this call. So like doing tea relief or whatever, and had other patients to look after. And the PET scan room is not on his floor. So he asked the help-all nurse to give the Versed, which was none other than RaDonda Vaught. Dun, dun, dun. Now, prior to this day, RaDonda had worked at Vanderbilt for 2 years. She had 0 incidents prior to this, and her colleagues said she was an excellent nurse, despite being relatively new to the field of nursing. So on this day, RaDonda was working as a resource nurse, as I said. Sorry.
Oh, what an awful job.
I know, in the neuro
It's
ICU.
It's got to be the most brain
And this is
dead
Boxing Day
job.
as well.
Oh, brilliant.
Yeah.
Just what you want.
Stunning. As you can imagine, there was a time crunch because the PET scan staff were waiting on Charlene to be pre-medicated with the midazolam, and she was already in the PET scan holding area, and she'd already had her radioactive med, and there's a limited time between.
Yeah, time's ticking.
Yeah, time's ticking.
Yeah,
exactly.
if you want an accurate scan
correct.
result.
RaDonda also had an orientee shadowing her named Darren Crooks, so another element of distraction.
Makes it very difficult.
It does.
doesn't it?
Oh my god! As
You've
someone,
got a whole other person to think about.
Yeah,
That's
and
not
it
your
just
patient.
takes away from what you're doing.
Absolutely.
Yeah. He had requested her to learn from because he felt she was very approachable and a good teacher.
Well,
So
that's nice.
it was reported that on the day, RaDonda was well rested, not overtired, and the unit was adequately staffed, and she was actually going on holiday the next day.
She obviously sounds like she has good qualities and
Yeah.
like she
Sounds like a good
cares.
nurse.
Yeah.
Yeah. For all intents and purposes, she
Yeah.
seems fine.
There's no like, well, so
Ominous
far.
things.
Yeah, no malicious
Intent.
intention. Yes.
It just so happened that RaDonda and her orientee were heading down to the emergency department to do a swallow study, which is actually right next to the PET scan area. So she was going there anyway. So she was like, yeah, sure, babes, I'll help you out. It's my job, you know. RaDonda herself admitted later that she was very familiar with the use of midazolam, or Versed for the Americans, and had administered it only 24 hours prior to this event. So hold that in your mind for later.
Okay.
Okay. Now at Vanderbilt, they used a machine called an AccuDose to dispense medications,
Like an Omnicell.
like an Omnicell or a Pyxis. At this time, there was also a problem that prevented communication between the EMR, the pharmacy, and the AccuDose machine, and this was causing delays in accessing medications, and the hospital's short-term workaround was to use an override function to access the cabinet. Yes, correct. To access the cabinets, which is normally only supposed to be used in emergencies. So, like, you've got someone fucking dying in the bed next door and you need, sucks to tube them or something. Yeah. You go, use the override, get it out, and that's what it's meant to be used for, not for just everyday patient care.
Yeah.
RaDonda would later say overriding was something we did every day. You couldn't even get a bag of fluids without using the override function. So it was a systemic thing. Because of the communication, because there was communication issues between their EMR. So what they do in the States, they have an EMR, the doctor makes an order, it goes to pharmacy to get approved, and then pharmacy put it on the AccuDose machine. So there was issues between that communication.
Gotcha.
So the doctor ordered the midazolam, it went to pharmacy, the pharmacy approved it and sent it to the AccuDose machine, but it didn't show up. Right. So it wasn't there.
Okay.
Does that make sense?
Yeah.
Okay. So, RaDonda accepted the task of delivering the Versed to Miss Murphy in the PET scan area, and she even asked Nurse Gully if Charlene needed to be monitored down there. So, good nursing stuff.
Yeah.
And Nurse Gully stated that she did not, as per the doctor's orders. So she headed over to the AccuDose machine with her Orient and pulled up Charlene's profile in search for Versed or midazolam. It's worth noting that she specifically typed in Versed.
Yeah.
So the brand name. It was not listed in the patient profile as an option to be dispensed. She admits at this time that she was distracted talking to Mr. Crooks about the swallow study. Now, it's unclear to me whether midaz just wasn't listed at all under the patient profile or whether she just didn't recognise the generic name for Versed. Because, as we know, medications are not listed in automated dispensing cabinets under their brand names. They're under generic names. So it would have been under midazolam, if my suspicions are correct. If the order was listed at all. But again, they were having communication issues between the cabinets and the pharmacy and the electronic medical records, so it's unclear all around. But what she did do was head to a patient room, bring up Charlene Murphy's profile on the EMR and check the order, and it was there. So it was in EMR, and it had been approved by pharmacy, but it hadn't shown up in the AccuDose machine. I don't know whether on the order it said midazolam or Versed.
They haven't. They don't.
I don't know. Couldn't find any info to that fact. So once she confirmed the order, she saw that there was an order there, and she was like, "Cool, so I'm right to give this." She decided to go do a cabinet override to get it. Instead of calling pharmacy and confirming. She could have done that, which would have been the safest course of action, I believe.
But of course she's thinking, I'm running out of time.
That is exactly what I had written next. Yeah, so she's
she's
on a time crunch. So she's like, fuck that.
Yeah, shit, got to get my bloody 12
I know.
and 1 and
Otherwise,
2 and 3
I'm going to get in trouble
because
it's on me. Yeah, exactly.
Yeah. Oh shit, haven't showered my 6th patient for the day yet. Like, fuck.
Yeah, exactly. So she was on a time crunch because Charlene already had the tracer for the PET scan, so they needed to get the sedation on board before the tracer was metabolised.
Yep, got to move.
Move. She then again searched for Versed, which is just... Come on.
Use your brain.
Yeah. When an override is done, a warning pops up, and you also have to give a justification for the override. RaDonda stated that the physician would be present as her justification. I do believe that just comes up as an option, and she's selected it just to get through.
Yeah.
And I think that's something they all did.
Yeah.
The warning does state medication should only be accompanied by stat orders when the condition of the patient would be significantly compromised by the delay that would result from the pharmacy review. She chooses to continue. When you override, the entire drug library pops up and you can search for anything. So, she can get anything out at this point, even if it's not on the patient profile.
I see.
She types in VE, and all the drugs starting with VE pop up on the screen. But again, all the drugs are listed by their generic names, so Versed was not there. So the first drug at the list was none other than vecuronium bromide.
Love it.
Dun, dun, dun.
How the hell?
Jesus. She selects it, and a drawer pops open with the multiple individual lidded
surprise!
compartments.
Take a vial.
So when you select a medication, the drawer pops open, and then there's multiple compartments with lids. For anyone who doesn't know.
Yeah.
On top of the compartment with vecuronium in it, it's worth noting that there was a label that said paralytic. So, warning.
Bright orange.
Vec, for anyone who doesn't know, vecuronium bromide is a neuromuscular blocking agent, which means it's a powerful paralytic, which
you
means
will stop breathing.
You will stop breathing, amongst other things.
Yes.
It's used to intubate patients and for surgery, basically, and nothing else.
Keep them still and keep them safe so they can operate properly.
Yeah, exactly.
Especially if they're going through muscle, stuff like that.
Given without an airway, a patient will die because it paralyses their respiratory muscles, which
airway
means
collapses.
Yeah, and their diaphragm doesn't work, which is an integral part of breathing.
That is literally how you breathe.
Literally how you breathe.
And it's a muscle, and guess what? Yes, it does get paralysed.
Yeah. So, bad juju. So it's also worth mentioning that vecuronium comes in powder form and nothing else.
It has to be reconstituted.
It does indeed, Queen,
It's
and you
not
just
as
read
simple
my
as
next
just-
line.
Yeah, it's not as simple as just drawing up a liquid.
Much like midazolam.
No, you have to read it. You have to look in a book,
Yeah.
an injectables drug handbook that tells you exactly what to reconstitute medication with. Either water for injection or sodium chloride. How much?
So
It's not, yeah. You would have to go and grab something to reconstitute it with, wouldn't you?
you would indeed.
Absolutely.
And she should know this. Anyway, it's worth noting that if the system was working correctly, it would have required a second person to sign off on the removal of the paralytic, much like an opioid.
Oh, and the vials
apparently.
also say paralysing agent, don't they?
Sure does.
The actual vials say
Sure
it as
does.
well. Yeah, they do.
We'll get to that, Queen.
Yeah, sorry, I'm getting
She's
excited.
jumping the gun, she's getting excited.
Yeah.
I love it. So it was also not only RaDonda's failure, but a failure of the AccuDose machine as well.
Yeah.
The system. Because
Oh,
it would have
so
put a
fancy.
barrier there and said, hey, we need a second signature to get this medication out.
A plus.
A plus.
A plus. You should put that in your essay.
I should just add that to the fucking Urban Dictionary,
exactly.
shouldn't I? RaDonda opened the compartment and removed a 10 milligram vial of vecuronium bromide. Inside the drawer is another label stating paralysing agent, just FYI. Just all the labels are vials. But she's in a rush.
It
and
must
she's
not have
distracted.
clicked. It didn't click.
Absolutely did
No,
not
she
click.
read it, but she didn't see it.
I don't even know if she read it.
Yeah. She didn't read it or see
I
it.
don't think she did jack shit. So she gathered 2 10 ml normal saline syringes pre-prepared, as they have in the States, and an alcohol prep pad and the medication in a baggie and headed to the PET scan room with her OENT in tow. Just please know, as a little side note, that we're laughing because we're appalled.
Yeah.
We're nervous for her. We're laughing because we're nurses.
Yeah, it's not because we're Australian and we're laughing at the word
we're
baggie.
assholes. Oh yeah, also that. But
That's why I'm laughing.
yeah, just know that we take the death of a patient very seriously,
Oh,
and we're
of
not
course.
laughing
My
at
gosh.
that. We're just we
No.
have dark humour and we make light of all
yeah.
kinds of situations. So
Oh,
please
yeah.
know that. Anyway,
And really, what is mostly like just hilarious about the situation is the whole shocking aspect of
It's
it, right?
absolutely
it's so
dumbfounding.
unbelievable.
and this is what like struck me
That's why you laugh.
so heavily, because when I came across this was in 2022 when the trial was happening, and I just immediately went on TikTok and did a video about it because I was absolutely fucking dumbfounded at how you could mistake midazolam for vecuronium.
Like,
in
that's the
any
whole
way.
like 10-minute process of
Yeah.
holding that vial in your hand
Yeah.
and doing stuff to it.
I was convinced that she had malicious intent
Yeah.
for that
that
reason. I did a video and I got absolutely got my ass handed to me by TikTok because they were like, you don't understand and you don't actually understand what's going on. And I mean, you'll find out why they did that. There's a lot of nurses that back RaDonda. So anyway, in this hospital, before giving meds, the patient's armband is scanned and the medication is scanned. So you scan the armband, scan the medication, and it pops up in the EMR, and I believe warnings also come up on the scanner if it's not the correct medication that is in the order. Does that make sense? So doctors do the orders on the system, which is then approved by pharmacy, and then it will show up on the patient profile on the AccuDose machine. The pharmacy had approved Medaz 10 minutes before the override was done by RaDonda. So she went back and forth and was like, it's not in there, I'm just going to do the override. But then by then it had shown up, which is unfortunate. It likely would have been there, as it takes 1 to 2 minutes to show up. But whatever, there was issues. Charlene Murphy was by herself on her gurney. RaDonda verified it was Miss Murphy by doing the, the standard check wristband. Then attached a blunt tip needle to the saline solution, punctured the top of the vial, filled it with normal saline, shook the vial, and extracted the whole 10 milligrams of VEC into the syringe. She did that at the patient bedside. So she would have had to flip the cap off that said paralytic.
A bright orange.
And apparently she looked at the reconstituting instructions that are on the vial as well. Apparently there's reconstitution instructions on the vial. I didn't know that.
Yeah.
As she was reconstituting, the PET scan tech came out and watched, so there was a witness. RaDonda started administering the VEC via a CVC, like an external jugular vein.
Oh my God.
I know, or internal.
Was she even approved to use CVCs?
She's an ICU nurse, so I would say
yes.
Yeah, she's an RN.
Yeah. Oh my God, that just makes it even worse.
It's just like
that
direct.
She's an ICU nurse.
I know.
How many times would have she have drawn up midazolam?
I know. She said she'd done it 24 hours prior.
Yeah.
Yeah. So she knew what Medaz looked like. But you'll
totally
see
different
why
looking
she
vial.
does this. You will see. Charlene reported to RaDonda that it was stinging going in, which that was such a cringe. She slowed down the push. She didn't check the vial. She didn't double check what she was doing. She just slowed down the push, continued to administer without further complaint from Murphy. RaDonda stated that she administered what she thought was 1 milligram and left. So if she drew up a full 10 mils, hopefully she only just gave 1 mil.
1 mil, if she only just gave
That
1 mil,
makes
that
no
wouldn't have
sense
paralysed
either.
the patient.
But that
it
also
wouldn't have been enough.
Like, because Medaz only comes in 5 milligrams in 5 mils, so even that.
Well, at least in Australia.
Yeah, but even then, like, if she's... anyway, we'll get to it. The PET scan tech then wheeled Charlene into a room in the PET scan area. At this time, Charlene had already been administered the nuclear tracer, as we said, which takes an hour to fully disperse through the system, and she had about 30 minutes left. So she was put in a room away from anyone, and all she had was a camera watching her, and the techs were watching her. So not medically trained individuals. So no monitoring.
Yeah.
As previously stated, which I think is interesting, given it's a sedative and she's an old lady.
With a lot of comorbidities.
Interesting choices by the doctor, I thought. Anyway.
There's no anaesthetist there.
I think they're treated by a team. Not sure who prescribed them, it does.
Okay.
Yeah. Charlene looked to be sleeping, obvi.
Oh, wow. Who would have thought?
Oh, Jesus. Which was to be expected after a sedative. So I'm sure no one really batted an eyelid.
No, she's relaxing. She's chilling.
We don't need to check on her.
Just leave her
We don't
alone.
need to check on the fact that she's had a sedative and that it could depress her respiratory drive. We don't need to check. What are you talking about? Anyway.
Yeah, don't be stupid.
No, just relax. Everyone chill.
She's sleeping.
She's sleeping. She's dead, mate. Anyway, not too long later, probably about 15 minutes, I think it was, they said, a transporter found Charlene unresponsive, so like an orderly, and alerted the PET scan techs. CPR was immediately commenced, and a code blue was called. The code blue team resuscitated Charlene, intubated her, and took her back to the neuro ICU. Wow. While all this was happening, RaDonda had gone to the emergency department to do a sleep study, but the patient wasn't there. So she just fucked off back to the neuro ICU, found her, Charlene's main nurse, Ethan Gully, to waste the rest of what she thought was the midazolam. She stated to Ethan Gully that the rest of the medication needed to be scanned into the system, so it was all legit, because she didn't find a scanner in the PET scan area. So she didn't do that. she didn't want to be walking around the hospital with a vial of midazolam in her pocket because that's not a good look. So that's why she went back and gave the vial to Ethan Gully. Does that make sense? Yeah. And was like, hey, we need to waste this later, but can you scan this in the meantime? Does that make sense? And then at that point, she got a call on her transport phone because she's the help all nurse to go help with the code blue in the PET scan area. Yeah. Because part of her job was to help with code blues.
Yeah, as a resource nurse.
As the resource nurse. Yeah, so her and the nurse in charge went down to the PET scan area to assist with the code, and she thought, that could be Charlene. On her way down, what am I, Irish now? Doon.
We're jumbling words up now.
On her way down. I'm Scottish. On her way down. On her way down.
Like some of the girls at work.
Oh, really? I love Scottish accents. Anyway. On her way down, she bumped into Charlene's family. Orkies, awkward, who knew she was in the PET scan area and asked if Charlene was okay. No,
because they've heard
she's not.
Code be called.
She's definitely not okay. They were concerned, rightly so. RaDonda responded, "I'll let you know, babes. I don't actually know myself."
All right, you were learning, babes. Send you a text.
Yeah. When the charge nurse and RaDonda arrived, the response team was there. And they had already intubated Miss Murphy by then. They had a pulse. They were going to transfer her back up to the neuro ICU. It took a better part of an hour to get her on the ventilator. Not sure why. Stabilise her and place several central lines.
Several,
apparently. She already had a jugular line, but I think they needed more. Who knows?
Like a femoral?
Possibly. They had reached a point where they had done everything they could. RaDonda was drawing another set of labs and went across the hall to tube them to pathology. At this point, she doesn't know what's going on. She doesn't know that she's given the wrong medicine.
She just knows her patient's
having an issue. Yeah. So she was sending some tubes to pathology in the sucker shoot thing, whatever that's called. And Ethan Gully comes up to her and he's like, "Babe, is this what you gave?" And holds up the vial. Oh my God. The second-hand embarrassment, the cringe, the absolute shock horror that she must have felt. She goes, "Yep." And he goes, "This isn't midazolam. This isn't first said, babes." And she goes, "Oh, what is that?"
Look.
Yeah. I mean,
read the vial.
Please read the vial.
He's holding it up to you.
He's holding it up to you, sweetheart. Oh. She asked him what it was and he said, "Vecuronium." Like, hello, it's Vecuronium, RaDonda. RaDonda asked Ethan to give the bag and it in its entirety to the charge nurse immediately. She asked him to do it. Shit herself. She's shit.
Yeah, she's not taking any responsibility right now. She's panicking.
No, she does.
I mean, in this moment, that she's asking.
I think she's delegating because she's going to go straight to the code team. This is what she does. She tells him to take the bag to the charge nurse and she goes straight to the code team, where the critical care anaesthetist, resident physicians and 2 other critical care nurse practitioners from the neuro unit were debriefing and discussing potential causes of arrest. Was it cardiac arrest? Was it a PE? Was it a brain bleed? Again, RaDonda then interrupts the conversation and I just can't imagine how fucking embarrassing this would have been. She said, "Remember when I was telling you throughout this process that Charlene got 1 milligram of midazolam on board, but it's not documented? Please know that I didn't actually give her midazolam. What I gave her was vecuronium."
Oh my God.
And then she just fucking spun on her heel and left. But I'm sure that, like, that's how it reads. Like, that's, for all intents and purposes, like, all the research I did, like, she just dropped the bomb and exited.
How does someone change like that?
What do you mean?
It's interesting. Sounds like she
I think it was shame. I think it was like, I have to disclose this, but I don't want to hear the reaction.
It sounds like, she's booked a flight for that night and she's fucking off to like Mexico or something.
She's going on a holiday the next day, which is hilarious.
Oh, she is anyway, isn't she?
She is.
Oh, no.
I know.
Oh,
at that point.
Shit.
But
she can't wait to get out of there.
Yeah. It was, I mean, I would want to fucking leave and never come back.
Yeah, I would want a hole to swallow me.
Yeah.
In the ground.
100%.
And then, gone.
Ostrich style, head in ground.
Yeah.
Yeah.
See you later. Never coming back. I've changed my name. I have a new identity.
I'm just going to go become a stripper and call it a day.
Yeah. My name's going to be Skinny Minnie. let's move on. Don't even ask me. It's embarrassing.
So at that point, RaDonda excused herself, as I said, and left the room. She went to the nurse educator's office, who happened to be there that day. She didn't return to the unit. She was not in any capacity to function in her role after that, obvi. After that, she spoke to a few different members of leadership, the Associate Chief of Nursing, Office of Risk Management, her manager, and she followed their instructions on what she needed to do, which was file an incident report, obviously. She explained what happened, that she'd given Charlene the wrong medication. They walked her through the process of filling out an incident report, and when that was done, it was later in the evening and RaDonda left the hospital. Never to be seen again. Just kidding. Just kidding. I can't imagine.
That's really what she was
did all the right
for,
things, though. She did all the right things in terms of disclosing her error.
Well, they would have found it out anyway, wouldn't they?
If they did an autopsy, which they did not. Anyway.
Continue.
Yeah. Charlene Murphy had a massive hypoxic brain injury, as you can imagine. She began having seizures in the neuro ICU post-arrest. And on the 27th of December 2017, Charlene Murphy was turned off life support and died, surrounded by her family.
So how many days did this take?
It was the next day she died.
Right.
Yeah,
Okay.
overnight.
A couple of days.
RaDonda obviously pained about it all night. She thought on it. She stayed up all night. And she was obviously going on holiday, so she wouldn't know the outcome. So she called the next day and asked. And they had informed her that she had gone. She'd passed. Rest in peace, Charlene. That would have been a horrible death. Yeah. She didn't have midazolam. She didn't have any sedative.
No,
she was
she
just given. Yeah. So she would have been awake.
Yeah, she knows that she can't breathe and she knows that she's paralysed.
She can't tell anyone.
She'll be panicking.
She can't move.
She's got no monitoring
She
on.
can't breathe.
So they can't see
No
her
one
heart rate go
knows.
up.
She's all alone in a room.
Yeah.
Like, let that sink in. If you think we're being mean about RaDonda, let that shit sink in.
Yeah, she died like that.
But RaDonda's not only to blame, this fucking hospital is too. And we'll get into it. So the warnings she ignored. Let's go into it. The emergency override warning. So that's one. When she selected the VEC, another warning popped up on the screen saying, warning, paralytic agent, on the screen.
She ignored that one.
She ignored it. Or didn't see it. I don't know.
Because she's talking to the other nurse.
Yeah,
She's
old
distracted.
mate. Another on-screen warning saying, warning, vecuronium bromide is a paralytic agent and causes respiratory arrest and the patient must be on a ventilator. And she acknowledged it. She pressed acknowledge.
Right.
Because you know how you have to acknowledge these warnings. You have to press, okay, I got it. The next big red flag. VEC comes in a powder form that needs to be reconstituted and midazolam does not. A neuro ICU nurse would know this.
One of the most confusing parts of the whole cases.
You would think.
She's given midazolam more than once before. She knows what it looks like. And I'm sure she's given vecuronium before too.
In order to reconstitute the vial, she would have had to read the reconstitution instructions. Is that a word, reconstitution?
Yeah.
Yeah, okay. We've made it a word. Add that to the Urban Dictionary as well. Okay. On the vial cap, it says paralytic agent. It's not a red cap, though. It's a grey cap.
Okay, it's different there.
Yeah, it should be a red cap.
Is there
There's
writing in
lots.
orange or red?
It's black.
It's all... Okay.
It's black and grey, but it says paralytic agent on the top. I've looked at it.
But there's no...
Yeah. It is on the side, though. It says paralytic agent in red on the side.
Okay.
Do you remember? Yeah. I'll show you a picture.
Oh, gotcha.
Let me see if I can find a picture.
Because I'm just saying, like, you know...
It's this one.
If that vial looks like all the other bloody vials, then, you know, it's
Can I
difficult
zoom in?
to...
Thank you.
Yeah, see, that's not... No, it says paralysing agent.
It says paralysing agent on the top. Can you see?
But it's just not as in your face.
It's not in your face. I'll show you the one that we use. I'll show you the one we use. It's actually a light brown lid.
Ah.
Yeah. And it says paralysing agent on the top. But also, it's very non-assuming, isn't it?
Yeah.
It could be way more.
It looks just like all the other ones next to it.
Yeah, and the other ones next to it is vancomycin and flumazenol. So, interesting. Oh no, okay.
It's like those clonidine and glycopyrrolate vials, few years ago. They looked exactly the same and caused quite a few med errors.
Yep. So RaDonda admits that she was distracted. Talking to her orientee about a swallow study, they will be doing an ED after they administer the medication to Charlene Murphy. She also admits that she thought that it was odd that she had to reconstitute the medication.
I wonder if she's thinking this is a new brand.
She is.
Uh-huh.
You called it, babes. You're so smart. Oh my God. You're so hot. I love you. Work life. But she said that because of a recent hurricane, medications were coming in different formulations because a lot of the local companies that manufactured these medications had got wiped out by the hurricane. So it wasn't unusual to get medications that came in a different form, whether it be solid, liquid. What? So she was thinking, oh, it's a powder, but whatever, it's probably just a new formulation. But she didn't read the vial. She also said that she wasn't directly looking at the cap when she flipped it off with her thumb, and that the cap was not red or bright, it was grey. How many times have you flipped a cap off without looking at it? Full disclosure.
I don't know. I guess I glanced at it, but how often do you actually?
But when you're like so familiar with that med,
right.
like say you get on Dan's or whatever.
I know it's a brown vial with blue writing.
Yeah. But like also like different writing, different brands, all of that shit. Like some on Dan's vials are blue, some on Dan's vials are brown. Like, so I mean, you can see how it happens. Like I can see how it's happened. But she didn't do the right thing at the same time. RaDonda stated after the fact, I thought to myself, I probably just killed a patient. What did I do to her if I didn't kill her? What kind of life-changing thing did I put her and her family through? I really fucked up. Yeah, babe.
You did.
Yeah. Understatement of the year, sweets. Darren Crooks, her orientee, stated that within 5 to 10 minutes of identifying her error, the medical team was notified. So he's just reiterating that she did the right thing and fully disclosed her error. Yeah. Which is, I mean, that's integrity, isn't it?
Yeah, it's hard to do.
It's hard to do, and I'll give her that. You know what I mean? Like,
She's honest. She didn't
that's
lie.
honest. That shows integrity. That shows concern for the patient. You know? Yeah. 2 neurologists, this is where it gets fucking interesting. 2 neurologists reported the death to the Davidson County Medical Examiner without mentioning the med error.
Can you say that
Let
again,
that
please?
sink
Wait.
the fuck in.
It's not going to sink in.
Is that not sinking in?
Can you please say that again?
So 2 neurologists, her treating physicians basically, reported the death to the Davidson County Medical Examiner without mentioning the med error.
Why?
The medical examiner reads the case and attributes the death to the bleeding on the brain and deemed it a natural death. I beg your pardon.
Well, look. Why did she have a bleed on the brain, actually? What triggered it? Was it seizures?
Well, they don't know because they didn't do a fucking autopsy.
So it could actually be completely
She did suffer from lung cancer. But that's not why they reported it that way. No. To cover up. Hashtag. Based on this info, the medical examiner did not do an in-depth investigation into her death, including an autopsy. And guess what? Charlene was cremated.
Yay!
Dun, dun, dun!
Because who wants to ever figure out what the fuck went wrong?
Yeah, but they're already breaking the law.
Yeah.
Not reporting that.
Yeah.
Mid-era.
So, I see. This is a cover-up. Well, all hospitals cover up though, don't they?
And that's
what they pay their lawyers for.
I know.
And their HR team.
That's why they have
That's why you get
boards.
Christmas bonuses.
Why? Why is that? Why do you need Christmas bonuses?
No, I'm saying that's why they get Christmas bonuses, because half the time their job is covering shit up.
Who gets the bonus though? Not us.
No, exactly. It's the people that, the lawyers and
so just like blowing smoke up their ass to keep their mouth shut. Yeah, got it. How do you feel? What are your thoughts? What do you think's going on? Do you think that she has malicious intent?
No.
Why?
I don't. Because she's... Okay, besides for the things she didn't do right, which caused the error to happen in the first place, everything after that, she did the right thing.
She did the right thing, yeah.
And like you said, she was honest. She
True,
didn't lie. She didn't try and cover up her tracks. She didn't deny anything.
But as we'll see, she gets tried criminally, which when you're being tried criminally, you have to prove intent, usually.
Yeah, you got to have, what is bloody year 10 legal studies?
I didn't do any legal.
Not corpus callosum. Part of the brain.
That breast?
No, that's a part of the brain.
Oh my God.
Corpus callosum.
I'm thinking colostrum.
Mens rea and actus rea.
Oh, mens rea, that's right. That's intent, isn't it?
Actus rea is the actual physical act committed, or in the case of omission, not committed in a crime. Mens rea is the intent or awareness of wrongdoing behind the crime. So yeah, mens rea is having the intent to actually do the crime.
So that's where we're going to leave it today, Olivia, because we are going to finish this case in part 2 because there's a lot of shenanigans that go on.
I'm excited.
Are you excited?
I am.
Well, thank you all for joining us today.
Yeah, it's been a pleasure.
It has been. We're working on an Instagram, FYI, for the pod. I haven't got it up yet. But I'm sure it'll be along the lines of Nurse Ratched.
Yes.
And once this episode goes live, we will put it in the show notes so you know where to find us and comment on each episode. We'll do a post about each episode, showing pictures. Maybe we'll put the vial of Vecuronium up on our Instagram so you can all see. Maybe a vial of Midazolam so you can all compare the pair. And yeah, so thank you guys for joining us for our very first episode. How do you feel, Olivia? Because you were nervous about this first
it's
episode.
actually completely fine.
It is. Yeah. Excuse the headphone sound.
Yeah, sorry about that.
I think
literally not doing anything. But...
She's just shaking her head. It's just the jack, I think. Anyway, it is what it is. We're working with limited resources. Yes. We're not rich. We're nurses, guys. Anyway, check us out on Instagram and we will see you in the next episode.
Okay, for part 2.
For part 2. Bye.
Bye.
Hey.